This is Gary Brecka, and I'm telling you, today truly is a very, very special podcast. I know very often I'll say, this is my favorite guest, or I'm really excited to have this guest on. But this particular guest has a very special place in my heart, and he's going to have a very special place in your heart too, because of the level of conviction that this man has to make an impact on humanity. And by that, I mean, I don't care what side of the political aisle you're on. We all should be on the side of the future of our children. Is someone I've looked up to for a long time since I really understood his mission. And when you look at the broken healthcare system in America, we spend $4.5 trillion a year on healthcare. We lead the world in six major categories: infant mortality, maternal mortality, morbid obesity, type 2 diabetes, multiple chronic disease in a single biome. And I don't think anyone, including myself, knows the exact reason why. Why do we have the highest rates of childhood cancer in recorded history? Why do we have such a parabolic explosion in autism, learning disorders, ADD, ADHD, OCD, manic depression, bipolar? And why are these things affecting younger and younger ages? Not how are they educated, but how are they fed? And so today's podcast, I'm recording this intro after the podcast because I wanted to just tell you how impactful it was, how he was able to break down the corruption in our nutritional research and the corruption in our food supply and the influence that big food and big pharma has over our public policy, the policy that determines how your children are fed, how your children are taught, and what our healthcare system covers and doesn't cover. Why are we so pro chemicals, synthetics, and pharmaceuticals? And why have we gotten away from things like peptides and whole foods and exercise and vitamins and minerals and amino acids and nutrients? The thing that God gave us to make us thrive, rather than the thing that man makes us to make us sick. We don't independently have our own healthcare choices because we walk down the aisles and the food that we're consuming is actually what's leading to the medication that's required to treat the conditions from this causal relationship between food and chemicals and health.